It is now time for another round of Transformation Tuesday, and today we are tackling myths and misconceptions around facelifts with board-certified facial plastic surgeon Dr. Michael Somenek. So let's send it out to Kid and our friends at Somenek+PittmanMD.
Transformation Tuesday on Good Morning Washington is sponsored by Somenek+PittmanMD. Well, I'm here with our good friend Dr. Michael Somenek, and we are going to learn all about facelifts today. So let's start with, what is a facelift?
Yeah, think about a facelift as a rejuvenation procedure. It really is meant to target some of the signs of aging, like the jowls that people start to develop along their jawline, the laxity in the submental or right under here with some of the banding or the muscles that start to hang there. So it really is meant to restore the youthful appearance to the face while maintaining your natural facial features.
I've always thought, oh, if I have work done, everyone's going to know I had work done if you had a facelift or something like that. Is that true?
It's such a common misconception, and it's something that we spend a great deal of time with our patients during the consultation process, because they all come in saying, I want to look like myself, and that's exactly what our goal is, to make you look like yourself, but a better version of yourself. And some of the more contemporary approaches to facelift, called the deep plane facelift approach, is something that I use on many of my patients. And it's a little bit more of an advanced approach, because what it's doing is it's looking at the face from a more global perspective, addressing not just the skin, but the underlying tissues, to really restore the natural appearance and the position of the fat pads that we had when we were in our 20s and 30s, and create that more natural appearance.
You said our 20s and 30s, so I've always thought that also facelifts were only for older people. That's not true.
No, that's becoming less and less common as well. It's such a misconception, because really age is just a number. And it's really about expectations, and everyone ages at a very different rate. Think about genetics, environmental factors, and how we take care of ourselves, quite frankly. And a lot of those things really contribute to how we look. And so there are some people in their late 30s, early 40s that they just have laxity that cannot be treated in any non-surgical manner. And so for those patients, I mean, a facelift is a very appropriate procedure for them.
You take great pride in your facilities. Talk about your private surgical suite that we're in right now.
Yeah, I think that once patients come here, they'll realize this is not just your typical large surgery center or hospital system. It's really meant and centered around the patient experience. We have one-on-one nursing. Nurses follow you from your preoperative area to the surgery to the postoperative recovery. We have physician anesthesiologists that really play an integral part in preoperatively seeing if you're an appropriate candidate, following you throughout your anesthesia needs, and then into the recovery area as well. Again, with the experience, we put many of our surgical patients across the street in the hotel, where we give a nurse to them, and the nurse basically stays with them all night to make sure that they're being taken care of. So patient safety is really at the center of the main goal here.
Simply the best, and thank you so much for a little education on facelifts and myths and misconceptions. Great to see you.
Yes, likewise.
You look comfortable in those scrubs, Kid.
I'm telling you, I wanted to take the scrubs home with me, but no, we had a great time there and a great conversation that I think it's okay to have those conversations.
Yeah, it made me feel more comfortable about talking about facelifts at any age, and knowing that if you are going to get plastic surgery, there's a place that's safe, that's trusted before and afterwards.
Yeah, and I'm telling you, every time you walk in there, the entire staff is so welcoming. You just feel so great. And if you want to have that conversation, you can just start that conversation with a great doctor like Dr. Somenek.
Yeah, and they're good people.
Always love going there.